All right, it's another beautiful afternoon right here in the beautiful city of Calabar, and you're tuned into UNICAL 103.5 FM, the only station that offers you education, information, and of course, entertainment 360. We love to call it Edu Infotainment. Good afternoon, Malabites and Malabresses. Good afternoon, ladies and gentlemen, friends and fellows, mummies and daddies. Yes, it is UNICAL 103.5 FM, the best station that offers you the best of education, information, and of course, entertainment 360. It is no news that today is World Health Day. I mean, your health is something that is supposed to be a priority. Knowing about your health and things that you can do in order to, stay healthy is something that you should prioritize. That is why we are bringing to you this special program centered around World Health. At this hour, I have somebody very special, somebody very impactful that is going to impact knowledge into us this afternoon. I am not going to let the cat out of the bag just yet. I'm going to go on a very short break. When I come back, I will tell you who we have in the studio with us this afternoon. Do not touch that dial. It's still UNICAL 103.5 FM. 127 on the DOT. Welcome back from that short break. If you're just joining us, it's UNICAL 103.5 FM, the only station that offers you education, information, and of course, entertainment 360. We love to call it Edu Infotainment. Like I said before the break, today is World Health Day, and in commemoration of World Health Day, we are bringing something very special to your listening pleasure. I mean, UNICAL Radio is renowned for education and information, so we are here to inform and entertain and also educate you this afternoon. So like I said, we have a very special guest in the studio, somebody who is, well versed in the health sector. She is a consultant, pediatrician, and the Director General, Cross River State Primary Healthcare Development Agency. A medical graduate from the University of Calabar, Nigeria, with at least 18 years of experience in general clinical practice. Her capacity has been built in various institutional and non-institutional governmental and non-governmental organizations, as well as the National Postgraduate Medical College of Nigeria. A fellow of the National Postgraduate Medical College of Nigeria, Faculty of Pediatrics, and award winner of the NNB International Bank PLC Prize for the best candidate in FMC PAED examination of the National Postgraduate Medical College of Nigeria. A winner of the Theodore Okehialam Prize of Best Abstract Presentation at the Pediatric Association of Nigeria PAN Conference 2024. Ladies and gentlemen, Malabites and Malabresses, join me as I make welcome the one and only, the delectable Dr. Vivien Mesembe Otu. Very good afternoon, Ma.
Good afternoon, UNICAL Radio crew. Good afternoon, Cross Riverians. Good afternoon, Nigerians.
Thank you for joining me this afternoon. How are you feeling?
I'm cool. Thank you for having me here.
Is it safe to say Happy World Health Day?
Yeah, Happy World Health Day out there to every healthy Nigerian, both healthy and non-healthy. Happy World Health Day.
Yes. Welcome on the show. It's such a delight to have you on the show. So let's just jump right into it because of time. So let's begin with a broad view. What are the major maternal health challenges women in Nigeria face today, especially in underserved communities? The theme for this year's World Health Day is humble beginnings and brighter future, something like that. So, what do you think are the maternal health challenges women in Nigeria face today, especially in underserved communities?
Yeah, the maternal health challenges women in Nigeria faces basically are due to, first of all, you must realize that Nigeria is a resource poor country. We are a developing country, and so our health sector is also underdeveloped. So basically, the problem our mothers face, especially when they are pregnant, is poor access to healthcare. Okay. So firstly, we have poor access to healthcare. We have dilapidated structures. Our facilities are poorly equipped, and even when you even get to the facility, aside from being poorly equipped, we have shortage of manpower to attend to these women when they come for the antenatal. So you find out that the women, even if they are ready and they are aware to come to the hospitals, the hospitals are not well equipped and are poor staffed to attend to them. Okay. So another problem we have with mothers, especially when they are pregnant, has to do with beliefs, traditional, religious beliefs, and this affects their accessing healthcare. Okay. So you find a lot of myths and misconceptions and a lot of them tend to patronize these traditional birth attendants and poor access to assessing health. The behavior of assessing health is generally poor in them. So they don't come to the hospital. They assess TBAs, and this they end up with complications during pregnancy. And then poor funding is also a problem. Where like I said, we are resource poor countries. Our patients, our clients are most times are indigent patients, so they don't have money to access the health care. This is because our insurance policies is poor or poorly developed, and so this unlike the developed world where they have free access to care, in Nigeria our insurance still has issues and is still underdeveloped. So poor funding for the women, so they are not able to access this healthcare completely free. And so you see them being withdrawn or don't even bother coming to the facilities. So these are some of the problems that they have. And then sometimes they complain of poor attitude of healthcare workers. So they will prefer to go to the TBAs. They say long waiting time in the hospitals and all that are some of the reasons or some of the things or challenges that we face with our women, especially when they are pregnant.
Amazing too. The theme for this year's World Health Day says healthy beginnings, hopeful futures. How does the theme resonate with you?
Yes, it's a very nice theme, and it has to do with mother and child. So when you say healthy beginning and hopeful future, it has to do with the relationship between the mother and the child. And so see that everything for you to have a healthy beginning, for you to have a hopeful future, the mother must be number one aware, have this health awareness. When she's pregnant, she's supposed to be aware that she's supposed to come for antenatal. So coming for antenatal gives the baby the opportunity of being a healthy baby when delivered, and she's supposed to access antenatal care, get her hematinics, her drugs that she's supposed to be on, do all her tests, and just have a healthy pregnancy. Where the woman fails to do that, the fetus in the womb is at risk of complications. And so that is why it's important that the woman access the healthcare in pregnancy. And when it's time to deliver, she comes to the health facility and delivers safely without complications. This also helps the woman to have a healthy baby. And afterward, the postnatal care, she needs to be aware of the things she needs to do. She needs to be aware that she has to bring her child for immunization. She needs to be aware of that she has to do things like exclusively breastfeeding so that she can have a healthy child. So you can see the theme for this year is focused on maternal and child. That the union between the two of them, it is only when the mother gets this right when she's pregnant, it's only when she gets this right at delivery, it's only when she gets this right postnatally that she's able to bring a healthy child, and then we can have a healthy future, a hopeful future for the world.
Absolutely amazing. I completely agree with you. Moving forward, with the looming threat of dwindling global health funding, especially from major donors like USAID, how do you see this impacting maternal health services in Nigeria?
Yeah, sadly,
it's a very sad reality.
Sadly, birth is the reality. We need to face the reality. A lot of our healthcare services were being funded by US and partners. Some of the partners are still around, but some that were being funded by the US have been withdrawn. Even at the level of primary care, we had to send some of the funding back to our partners when they requested for it. Some programs that were being funded, that some activities that were still pending, they asked for us to refund, which we did.
That's sad.
So you can, sadly. So that is the reality we have to face. Because like I said from the beginning, we are resource poor countries, we are underdeveloped, and we depended a lot on this sponsorship. But the truth is that they cannot continue to feed us. These things they are not sustainable. So it's up to Nigerian government to live up to expectation. US is shutting down, they are getting back all their funds, they are folding up. So it is up to our government. Of course, it's going to affect some of our services, our training and all that. So the government needs to live up to expectations and fill up the gaps and have sustainable plan on how to continue with these health programs, these health events. These are the only way that it can be sustainable. There's no partner that is going to continue feeding us and it forever. It's just for a short time, and once they say they are done, they are done. So the government had to live up to expectation, come in and take up whatever funding they were getting from these partners to make sure that there is no gap created, because any gap created will affect not just the mother but the child and the general populace at large.
Okay, amazing. So you said that Nigeria is a resource poor country. Now, can you highlight some low-cost practical intervention that have proven successful in improving maternal health outcome? Because at the end of the day, right, when these donors are no longer there, we just have to look for a way around it. So do you know any low-cost practical intervention that have been proven successful in improving maternal health outcomes?
Yes, generally, like what we do at the level of primary health care, we have what we call the basic health care provided funded facilities. Okay. These facilities is found one in every ward. Okay. And so for instance in Cross River State we have them in 196 ward. Now these basic healthcare provided funded facilities are facilities that have insurance, and so we insured the vulnerable groups. Who are the vulnerable groups? The vulnerable groups are the pregnant women, the under 5, the elderly. Okay. So they are being insured. Okay. And so they access healthcare free of charge. Okay. As long as you are being enrolled under this program, you are entitled to free of charge healthcare. And so the thing is, are people aware? Okay. Sensitization is the key. When people are aware that these services are there at the level of our primary health care, at our basic health care provided funds, and they're able to come in, there's provision for them to access all level of care free of charge. And so these are some of the things the government can do to help the pregnant women, to help people access free, especially the vulnerable group, to access free services. There are other things that the government can do by providing counterpart funding, going into partnership with people like the World Bank, like what Cross River State is doing through the Impact Project. The governor put down the counterpart funding, and then this helped them. This brought a collaboration with the World Bank, and the World Bank is helping us. Due to the counterpart funding that the governor dropped, the World Bank is now helping us to renovate some of our facilities, do some training, employment of skilled belt attendants. And so these are some of the things that the government can do. There are other partners, not only US, there are other partners that are on ground, that are around. You can enter into partnership with them. NGOs, well-meaning Nigerians can come in and support. Recently, some of our politicians are buying health insurance for their constituency members. So these are the ways that you can help them access free care at the level of the constituency. So in the long run, with this withdrawal services by the US government, what we need is partnership, collaboration from all aspects in the society, the government, the NGOs, well-meaning Nigeria. Everyone should just come on board and see how they can help to push the health services and health system forward.
Amazing. Time check is 40 minutes past the hour of 1, and it's still UNICAL 103.5 FM, the only station that offers you education, information, and of course entertainment 360. We love to call it Edu Infotainment. Today happens to be World Health Day with the theme Healthy Beginnings and Hopeful Futures, and we are particular about maternal health. That we have Dr. Vivien Mesembe Otu in the studio with us today. Now, Dr. Vivien, let's move away from the World Health Day just for a bit. Let's talk about you. You have over 18 years experience in medical practice. How has the journey been for you?
Well, will I say half or more than half of the 18 years with my residency program? When you finish school, you go for your NYC, you go for your internship, Then I did my residency program, and before I became a consultant. So it's been 18 years of working, learning on the job, experiencing, getting experience from dealing and handling with patients, having job satisfaction from what you do. Of course, I'm a pediatrician.
Yes.
So when I treat my babies and I see them healthy, it gives me job satisfaction. But we are not yet where we are supposed to be in Nigeria, and that is why you see a lot of Japa syndrome. But everyone cannot Japa. People like us have chosen to stay back and then give back to our society. Yes, it's been a tough one. I must tell you, it's not been easy. Being that you have to combine it with family life and everything. But what keeps you going is your dream. My dream have kept me going, and I'm happy where God has placed me today. And in the course of it, because I just try to do my best at every given time I find myself. I've had series of awards, to God be the glory. And so it's really been 18 years of working, learning, reading, gaining experiences on the job, and this is where I am today.
Amazing. We are so happy to have you in our midst this afternoon. Okay, moving forward, still talking about maternal health, right? Why is preventive care so critical in reducing complications during pregnancy and childbirth?
Yes, preventive care is very important. Like I said, one of the major problems that we have in our locality is poor awareness. The awareness to health services, healthcare is really poor, especially at the rural setting. So what I do at the level of primary health care is to do enough sensitization, awareness, let people know the advantages of coming to health facility, let people know the complications that may arise if they keep practicing what they are doing. And then, so generally we do a lot of sensitization and awareness. We want people to come on board. But yes, you don't go out there to create awareness, you have to prepare to receive them when they come. So like at the level of primary care, we had a lot of dilapidated structures and poor health workers, shortage of manpower, which we are working on currently. If you look around in Cross River State, you find out that a lot of our facilities are being renovated. There are at least one per ward is being renovated across the 18 local government in Cross River State. We want our facility to be up to date, to be equipped, and then the government is also helping us to employ manpower, so to increase on the manpower in our facilities. So we are getting ourselves ready while we are creating awareness and sensitization out there for people to access our facility. So we don't want a situation where they come to a facility and the same complaint is still there. We are arranging it and getting ready. So people are really coming to the facility now. Our level of the rates, our data has improved. The number of deliveries per month have improved. The number of immunization has improved. So the awareness is good out there. The bottom line is for them to be able to accept quality healthcare. This will help us have healthy mothers and healthy babies, and
a healthy society as well.
Healthy society, of course.
Absolutely. Okay, let's move over to another perspective. Let's look at this whole thing from the technological perspective. How is digital technology like mobile health and telemedicine helping to improve maternal health, and what's its potential for scale in Nigeria? Yes,
that is one area that we are really looking at, especially at the level of primary care in Cross River State. If you notice recently, the governor launched distribution of laptops to 196 of our facilities, and we are also going to procure more laptops to our facility. We really want to digitalize all that we are doing in our facility, because you find out that we lost a lot of data with this manual stuff. So we want to digitalize all our facility to make sure that all our data are being computerized, and so we'll no longer stand the chance of losing them, because we need this data to help us check where we are, what we are doing, how we are doing, outcome, and projects for the future. Aside that, telemedicine is going to help us to, especially with the case of poor manpower. So when you have this telemedicine, a doctor can sit wherever he is and still have to consult people, not It mustn't necessarily be physical.
True.
So it's something that we are really looking at the level of primary health care and even the secondary health care in Cross River State, because we know it's going to improve in the healthcare system and service delivery.
Amazing. So I'm a firm believer that maternal health doesn't stop at childbirth, right? What should our system be doing to support mothers' long-term health and well-being after delivery, like post-delivery?
Okay, what should the system? Sorry, I didn't get your question.
What should our system be doing to support mothers' long-term health and well-being?
Okay, a lot has to be done. Like we always say, sensitization is very important.
Okay.
Awareness is very important. So going out there to the community and creating awareness on the pros and cons, the importance of them assessing healthcare.
Okay.
The complications that can arise if they fail to do so. If they keep on patronizing the TBAs and all that, what complications that can affect both for the mother and for the baby. The causes of maternal mortality, the causes of under 5 mortality, the causes of neonatal and infant mortalities, all this awareness needs to be created out there. We need to disabuse the people on their traditional religious beliefs that affect healthcare system and practices. Myths and misconception needs to be addressed. And then poor funding too. Like I said, our insurance needs to be strong so that people can be able to access free healthcare services.
Okay.
So we need to do all this. The government needs to come in and invest a lot in health system so that people can come in, they can have good environment, and that the facilities should be well structured, equipped, and the manpower should be there. And apart from that, they should be able to access it free.
Okay.
This way, the mothers will gain confidence in the system and will come, and in the long run, we'll be able to reduce the mortality and morbidity that could arise during child bearing and during the formative stage of the child.
Okay, you've spoken so much about myth around maternal health, right? I think I would love to know, out of curiosity, what are some myths around maternal health that you've heard about?
Well, there are some superstitious belief, like a woman may need to do a cesarean section, and due to either her belief traditionally or religiously, they might tell her, if you go and once they put knife on you, you die. And you see, such a woman will never come to access health facility for them to do the CS for her. She will then end up in either TBA or in churches. She will now have obstructed labor, obstructed delivery, and of course, the baby can never come out well. Either the baby comes out is severely asphyxiated, and then at that point they will now refer. What magic do you want to perform? It would have been better prevented by the woman coming to have a cesarean section. So you now end up having a cerebral palsy child, a child that is useless to the society. So these are some of the myths. Some when the mother is pregnant, a lot of taboo. Don't do this, don't eat this, don't eat this. All this needs to be addressed at that level so that we can have a healthy child.
Amazing.
Yes.
It's a UNICAL 103.5 FM, and we have Dr. Vivien Mesembe Otu in the studio talking about maternal health as we celebrate World Health Day today. We're going to go on a very short break, and we're going to play Common Person by Burna Boy. Do not touch that dial. It's UNICAL 103.5 FM. 1:52 on the DOT. Welcome back from our short music break. That was Common Person by Burna Boy. If you're just joining us, it's UNICAL 103.5 FM, the only station that offers you the best of education, information, and of course, entertainment 360. We love to call it Edu Infotainment. Today happens to be World Health Day, and we have in the studio with us Dr. Vivien Mesembe Otu, and we've been talking about maternal health. Right about now, it's time to just have our last words and just wrap up this segment. So let me ask you this quickly. Finally, on this World Health Day, what message would you like to share with health workers, policy actors, and expectant mothers in our audience?
Okay. For the health workers, I want to say that they should keep up the good works that they are doing. They should keep doing what they are doing in their little corners. When our mothers come there, when our children come there to access care, they should be of good We should give them the needed attention that they need.
Okay.
And some complaints of health workers' poor attitude towards the client. So I want to encourage every health worker there to try to accept the client as their own and give them the necessary care, good attitude to work out there. For the policy makers, for the government, this is just to say that the government needs to sit up, the government needs to put down policies that will help the health system, just like Governor Sweet Prince Mesembe Otu is doing, is putting down good health policies that is helping us in our health system. Of course, you know that if he had not put down the counterpart funding, the partnership we had with the World Bank, National Primary Health will not hold. And so he's doing a lot out there, and that is why you see that we are renovating, rebuilding, revitalizing our health sector, especially at the primary level. So these good policies are very good in helping the health system, strengthening the health system, and of course it helps the people out there to gain confidence in the health system. For our mothers, our dear mothers, I want to say happy World Health Day to you. I want to encourage every mother out there to keep accessing health system for their well-being. I want to discourage them from patronizing the traditional birth attendants. At any time they need any help that has to do with their health, they should come to the facilities. The facilities are being renovated and equipped. We have increasing the number of health workers in our facilities, so the attention will be there. So they should do as much as possible, try their best to access this facility so that they can access quality health care, because the outcome of the mother, whatever behavior the mother puts in, we will determine the outcome of the baby, of the child. So our mothers, our caregivers need to have the right attitude, the right system, the right practice that has to do with their health care, so that it will in turn give us and produce healthy children, healthy babies for us. I will not leave this place without talking about my big catch-up.
Okay.
So, because it's part of what we are doing at the level of World Health Organization.
Okay.
So the big catch-up is on, and it's taking place from the 9th to 17th of April. So this is the third round. What is Big Catch-up? Big Catch-up was initiated in April 2023 by the World Health Organization. So this is a global initiative where the Immunization Agenda 2030 partners came together to look into immunization gap. So remember when we have the COVID-19 pandemic, there were a lot of isolation, people were meant to stay at home. So a lot of our children missed their routine immunization. So we had immunization gap. So the Immunization Agenda 2030 partners came together and said, what will they do to close up this gap? And so that's how they came up with the big catch-up. Round 1, 2, 3. We've done round 1 and 2. This is the third and the final rounds, and that is why we are hammering on the sensitization, because we want to pick out every zero dose child. Who is a zero dose child? A zero dose child is any child under 5 that have not taken any form of immunization or have missed 1 or 2 antigen. So we are talking about any child that is unvaccinated or under-vaccinated. Those are the people we are looking for in Big Catch-up. So Big Catch-up, we are going out there to fetch out these zero dose children and make sure that we immunize them. We do not want to come down with outbreak, especially with the weakening of our health sector. So we don't want to come out with outbreaks. It will really be a great burden to the health sector. So it's a global initiative, and for Cross River State, emphasis is on 3 local governments, which is Calabar Municipality, Ikom, and Akpabio. These 3 local governments has the highest number of zero dose children. But in practice, we are doing 9 actually. So we have included the other 6 local governments around these 3 local governments. So we are going out there in search of these zero dose children. So I'm reaching out to all our caregivers, mostly the mothers, that they should bring out, search every under 5 in their homes and bring them out for this immunization. 3 strategies have been employed for this immunization. The fixed fixed strategy in which they can come to us in our fixed area, that's our primary health care facilities. We have the vaccine there. We have the outreach strategies where we go out there and run outreaches and immunize children. You see us in churches, anywhere that people are gathering, my health workers will be there and conduct outreaches. But we also have the mobile vaccinators where the health workers are going door to door to vaccinate these children. So this is taking place from Wednesday the 9th of April down to 17th of April. So we urge every caregiver out there to help us get this under 5 that are either 0 dose or under immunized. The bottom line is to get every child under 5 years immunized and prevent outbreak, and so we can have a healthy Cross River State.